Medication utilities in Welford chart notes. This lesson will show you all of the different utilities you can access from a medication editor in Welford chart notes. Here we see a medication editor open. Highlight a medication and press Utility. The Utility menu appears. Alerts are contraindications, warnings, and precautions between a patient's medications and that patient's active problems and demographics, such as childhood, elderly, and pregnancy. You can check all of the drugs on the list at once for any alerts, check just a highlighted drug, or look up the alerts for the highlighted drug. Let's check for alerts about citalopram. We see there is one highlighted in red because it is very serious. The patient has hypokalemia, which is dangerous in patients on citalopram. Double-click or press View to read more information. This screen shows you the nature and severity of the warning and the steps you can take. You can press Jump to move to a different program function to take those steps. You can also right-click on a highlighted line to open the utility menu. Click on Algorithms to see branching sets of questions relevant to the highlighted medication, which aid in diagnosis and treatment. You can jump to the patient's allergy editor or check to see if the patient is allergic to any of the medications on the list. Click Brochures to see patient education brochures relevant to the highlighted medication. The program comes with a library of brochures covering diseases and medications, updated quarterly, which you can edit, and you can add your own brochures as well. Click Comments to write some additional information about a particular medication. Note the marker which appears in the comment column when a medication has a recorded comment. Click Doses to see dosing information. You can check all of the drugs on the list at once to see if any of them have an inappropriate dose, or check just the highlighted drug. Choose Dosage Forms to see all of the available formulations on the market. Click Look Up this drug to see detailed dosing information about the drug. From here you can jump to other program features, UpToDate, and Dynamed. Click Dynamed to read about the highlighted medication directly. Click Find to locate a medication or other drugs in the same class on the list. Click Fix to rebuild the index to the medication editor. You can see if any of the medications on the list are not in the patient's formulary, check just a highlighted drug, and edit the formularies. Click History to see when the dose of the medication was started, stopped, or changed. Click Interactions to check all of the drugs on the list or just the highlighted drug for any drug interactions. You can also look up the interactions for the highlighted drug. In this case, the patient's citalopram interacts with omeprazole. Let's read more about this interaction. From here you can jump to other program functions or choose to override the warning if you have proper authorization. Click Mark to designate one or more medications to be included in prescriptions. Click All Overdue to automatically highlight all of the medications for which the patient is due for a refill. Click Medication Summary to see a monograph with detailed information about this medication, including references. Click Options to adjust your preferences regarding medication editor operations. Click Overdue Refills Report to see which medications on the list have not been refilled in a timely fashion, showing you when the patient last had it filled, how many refills, and when it was due to elapse. Use this to identify patients who are non-adherent. You can print a list of the patient's medications. Press Doctor List to print using medical terminology or Patient List to translate dosing instructions into plain English. Click Reconciliation to record and review medication reconciliation information. Click Import File to directly import a medication list stored as a file from another program. Click Log to see all of the times that this patient had medication reconciliation done and what medications the patient was taking on those dates. Click Reconcile Now to declare that this current list is accurate and document upon what basis you made this determination. Click View to view an image file such as a scanned handwritten medication list side by side with the medication editor on your screen. Click Revisions to see when information was changed about a medication and who recorded that change. Click Rx Log Editor to see the prescription log, and Rx Log Last Refilled to see the last time the patient had this medication refilled. Click Rx Writer to write a prescription for this medication. Click Snapshot to see what medications the patient was taking on any given date. Click Back or Next to jump to the next time that the list changed. Click Sort to redisplay the medication editor in a different fashion, such as chronologically versus alphabetically by drug name. Click Test Reminders to see if the patient is due to have any particular lab tests in order to be properly monitored while taking medications. You can check all of the drugs on the list, check only the highlighted drug, or look up all of the test reminders for the highlighted drug. Click Undo None if you accidentally pressed the None button to indicate that the patient was never taking any medications, thus erasing all of the medications on the list, and want to restore the list. Click Up to Date to jump directly into Up to Date to read about the highlighted medication. Click Visitor to see the patient's visit when the medication was started, when it was stopped, or any visits that discuss the medication. Click Vocabulary Editor Classmates to see all of the other medications in the same class as the highlighted one. Click Editor to look up the definition and synonyms of the highlighted medication. Click Web Links to see a list of internet sites regarding the highlighted medication. This concludes our overview of medication editor utilities in Welford Chart Notes. For more information, visit us at emirj.com.